Good morning. This is Angela Kelley. I am the early childhood specialist, and we have
Destiny Murray.
and she is another specialist too, another early childhood specialist. And we're going to do a presentation this morning on early child transition, meaning when I'm going to start my slideshow here. I'm kind of behind. When children transition, that means go to Part B, and we are Part B. Schools are Part B, in our state, Part C. Special ed services is Sooner Start. And this whole presentation is going to give you ideas for IEPs that you will be writing, what things you need to consider, and kind of the flow of how that works. The transition from Part C to Part B is a requirement by IDEA to fulfill the need to make a smooth and seamless transfer from C to B, and it is part of our state performance plan that we have. It's Indicator 12, and this is just a flow chart that Destiny made for us. It tells you what you start with, the TPC, which is a Sooner Start meeting, okay? But schools are required to attend. Then we have that review of data. You can do that at the TPC if you would like, but you may have to carry it over to another meeting. You get parent permission on an evaluation just like you do for any other child find activity. Comprehensive evaluation, notification of meeting goes out, you have a MEEGS, you write an IEP if it's applicable, and then you provide the written notice to parents. So that's your flow chart. That's kind of, everything in here is pretty much the same except that TPC on any other child find activity that you do in your school. Okay, the transition planning conference, as I said, is a Sooner Start meeting, and it's to facilitate the school and the parent getting together and planning what's going to happen. And in that meeting, you want to share, they will share information on their services. You want to encourage family participation. You want them to know about what the programs are and services in your school, and then you summarize the steps for the parents, so they are understanding what's going to happen. You need to have sufficient information that you can gather together from Sooner Start and anything that your parents need to give you, maybe medical information, so on and so forth, because some of that will be going on your near MEEGS. And then the group may determine that additional information is needed, just like at any other meeting or read, and then you can follow suit on that. If an evaluation is needed, you'll need to get your parent consent. And remember, even with the 3-year-old, you have the 45-day timeline, okay? 45 school day timeline. So if you start this process very early, then you're going to get to the end of it, and you'll make your IEP effective when services begin on the child's 3rd birthday. That's not uncommon. That happens several times, but you have to make the IEP effective for the date the services begin. At the meeting, or even before the meeting, parents can decline school services. They can do it with Sooner Start. They could come to the meeting and say, nope, this is not for me. I don't want my kid in school. Okay, that happens, and we usually try to get that wrapped up by 90 days, but it can happen anytime up to the date the child turns 3, and then that's something you'll have to deal with very quickly. Again, we want to let you know that parent consent, even with 3-year-olds or 2-year-olds, going to be 3, have the 45-day timeline for school days. And then say we've done the reds, we completed it, we've got all the information, we got a parent consent form signed, and then at that time, then you're going to look for a comprehensive evaluation. Now, you can take all information that's provided by Sooner Start, and you will need to probably do a few things internally in your school to make that comprehensive. Comprehensive just means you are looking at the total child, okay? This is the actual definition that is on page 76 of our handbook. Qualified examiner. Even with babies with 2 years old, going to be 3, you have to have a qualified examiner to make a determination and to administer tests, because that is the key thing about a qualified examiner. They not only administer, but they also interpret, and that is a key thing in the educational assessment process. SLPs, speech-language pathologists, are also considered professional qualified examiners in the area of speech, language, and communication skills. It could also be determined possibly that the physical therapist, OT, could be the evaluator, and they could be the qualified examiner in their area. But normally you're going to have a qualified examiner, a school psych, to administer and to interpret at the meeting. Then you have your MEEGS, your Multidisciplinary Evaluation and Eligibility Group Summary, okay? We all know what that is. That's where you record all the information you attained during the assessment period, and at that time, the team, the MEEGS team, makes the consideration and places the child in special education because of the fact that they have met the criteria that is outlined in our handbook, and because, you know, as trained professionals, they know how to place children. But please be aware, you always need to consider all information about your child. One of the critical components, especially with young people, is parent. Parent input is one of the biggest things you need to listen to, because those parents have a 2 going on 3-year experience on what that child can actually do, and their observations and information is critical. Okay, here's your group that are required to attend your MEEGS. Of course, the parent. I'm putting the student, if applicable, because this came from another PowerPoint, and for your older students, you might want to consider that. But normally, probably for a 2 or 3-year-old, that's not going to be important. You need your qualified examiner, just like we went over, any service provider, speech, OT, PT, so on and so forth, because they are going to interpret their assessments. Speech, a special education teacher, and a general education teacher. Now, let's talk about that. General education, you say, well, we don't have 3-year-old programs. Well, that's fine. I bet you have pre-K, because that's required. In most districts, they all have a pre-K. That would be an excellent early childhood general education teacher that can tell you what typically developing children, you know, what expectations there are for a 3-year-old, because most of them have the degree in early childhood, and they're gonna know even younger than 4 years old. You must have an administrator. It can be anyone in the school, but an administrator binds the school for assets. So during this period of the MEEGS, when you identify and going into the IEP, at the MEEGS meeting, you have to have an administrator who understands IDEA and can bind the school. And the other people that could be involved in this are just people invited by the parents. They could be advocates. They just could be support. You know, it might be very beneficial if a Sooner Start person came, if the parent feels like that's something. And any other qualified professionals that are appropriate in this process. Okay, I just thought I'd throw this out there for you. It's the 13 disability categories. I'm sure you're all very much aware of it. The 13th one, the developmental delay, is something that all school districts in the state of Oklahoma have to make the determination at the end of the school year every year. Do they want to classify and place children in special education under the category of developmental delay, or do they want to do specific category? And in our handbook, there's some real good information about considerations for developmental delay. The other thing we have, and will have to be placed on the MEEGS, is we have to have with that MEEGS a suspected disability. And the reason we do that is because in the state of Oklahoma, we don't have a weight specific to developmental delay. Your weight that you receive your funding on is compared to or it's tied to, I should say, tied directly to what your suspected disability is. Then you come to the IEP, and as we did say here before, if a student is determined eligible, the team should reconvene and write an IEP and within a 30-day period. So that gives you a little bit of play there to get to their third birthday, but you could also do it at the MEEGS meeting if you want to, but make the IEP effective on the date that is the child's third birthday. And again, I just want to reiterate, the law states that on a transition situation, that you must have an IEP in effect on the child's third birthday. So that's critical, very important. Otherwise, when you do your reporting at the end of the year, it will show a deficit for you. Okay, and then we have the IEP team. And again, it's pretty much the same people that are involved with the MEEGS. I'm not going to go over it. And then you could have other individuals who have knowledge of special expertise regarding the child, okay? If you have a child with a suspected autism, you may have an autism specialist that attends, or if they are orthopedically impaired, you may have someone like that, or visually impaired. And, you know, I want to go back real quick to the categories of disability. If you have a child with either number 1, number 2, or number 12, those categories, those are considered sensory disabilities. And you can never put, if you are a developmental delay school, you can't put children with sensory impairments in DD. They have to be in their standalone category, okay? So even a 3-year-old would be considered deaf-blind, deaf or hearing impaired, or visually impaired, okay? Those are the key, and hearing impaired, I'm sorry, 5, I didn't even see that. Those are the key factors right there for the exceptions to developmental delay. And then the IEP team, as it gets together, and also parent can bring anybody she wants to the IEP meeting. She does not have to disclose prior to the meeting with the school who she's bringing. She can bring them in. You, however, as a school district, have to let the parent know who is going to be at the meeting, and you do that on your invitation to meeting. The IEP team must consider all the strengths and the educational needs of a child and the results of the evaluation. You've got data that you've collected on this child. Use it. Don't just make up any kind of gold that you think might be appropriate for a 3-year-old. Look at your data. Base it on your data. And then you need to have developmental, functional, and educational needs that that child will need to be successful in school. Also, you want to always write down parent concerns, okay? That is a critical component in any IEP, not just a 3-year-old. And make sure that you are providing the provision of faith, free of appropriate public education to all children. Okay, IEPs now want you to look and address special factors. They want the goals to look at it. They want to know what your progress towards goals are. You need to include that in your IEP where you're stating, okay, maybe in that first part narrative, like, you know, Angela has done well and has accomplished up to 65% of her goal or whatever the past year brought about. You want to address all accommodations, and now we're looking even at assistive technology. So all those, and assistive technology would fall under special factors. We want to make sure that we're covering the child's total educational needs. Here's just a sample of related services, okay? It's not the end of it. It's just, these are just some things. Transportation is also considered a related service and should be included on the IEP. Any psychological services, you need to include those, or if the child is receiving those out of school, you will put that you are not responsible, but these are things that are helping the child with their educational needs. Okay, and anything else that you can think of. Always remember and think of the least restrictive environment. We call them in young children, in our pre-K kiddos, we call those early childhood environments, which is something that you need to always think of. All children learn more from children. The modeling process is always there. And so think of options that are there. We want to think of structured options, not just a daycare setting or Mother's Day out. We want to consider now that if there are any 3-year-old programs out there, either private or public, Head Start is a wonderful program and does a great inclusive, education of young children, 3- and 4-year-olds, and then any group development center that is actually a learning center, not just a daycare provider. But many times they're a daycare too. Here are what we consider regular early childhood programs. We like the Head Start as one, the kindergarten as one, the pre-K. We like private kindergartens, either that are accredited or even non-accredited as they are considered in their accreditation process, and group development centers, not just daycare. Okay, but they can include daycare in it. And of course, I don't know if I said Head Start, but I feel like I didn't. But Head Start is excellent, one of our better programs. Okay, this is short and sweet, but I want to tell you, if you have any questions at all, call me or Destiny, and we'll be glad to help you. I can't think of anything else. You think of anything, Destiny?
Just make sure that an IEP is in place by the child's 3rd birthday. If, in fact, you run into a short window, those 45 days will exceed the child's 3rd birthday, you can always test and meet before on the child's 3rd birthday. And on the services page, make sure services begin on the day of the child's birthday. Even if their birthday falls on a weekend, make sure it's the child's 3rd birthday.
Okay, thank you.